Because this is not your first RevoFit rodeo, we thought we could up the ante a bit. This video will introduce you to an AK definitive socket design that incorporates 2 dials, controlling 2 adjustable zones. We call it the AK 2-panel design that rocks. Well, okay, just kidding, but it does kinda rock. This socket design places pad-lined movable panels on the lateral and medial side of the femur and has a posterior cutout. The panels are adjusted by 1 dial to increase compression around the limb, and a second dial adjusts a posterior strap to optimize fit. This design gives the patient the ability to compress around the femur to stabilize the limb, and proximal adjusting to stabilize the pelvis at the same time. The compression around the limb also eliminates pressure on the tip of the femur. It's kind of amazing, at least according to the patients we've talked to. Before we expand on the specifics of this particular AK design, let's outline some of the fundamentals of RevoFit socket design. These are the basics you will keep in mind when designing any RevoFit socket. And the design possibilities are infinite, so learn the basics as the key to unlocking the countless number of designs that you can create. The movable panels are placed on soft tissue. Stay away from bony protrusions or sensitive areas. Panels typically terminate proximal to sensitive and bony areas. This allows for compression above the problem area rather than on it, which often creates relief. The panel closest to the dial will adjust first, and with the greatest amount of force. Route the lace to the biggest panel first, if possible, to ensure the greatest amount of adjustability. Always use the quarter rule to mark the lacing pathway across the panels. Keep in mind that this AK 2-panel design is for the RevoFit definitive socket you will build. The RevoFit check socket you will build will be similar, but with a few handy shortcuts. So the following design elements are applicable to the AK definitive, but not necessarily to the check socket. Now, let's get started with our AK design by asking 3 basic design questions. Where do I place the movable panels? Where do I put the dial? And how do I make it all connect? Panel locations on an AK socket are relatively uncomplicated and are the same for both the check socket and the definitive. They are placed on the medial and lateral sides of the femur where they can compress around soft tissue and avoid any pressure-intolerant areas. The panel on the lateral side will be slightly longer than the medial panel to provide greater stabilization along the length of the femur. In addition to the 2 movable panels, this AK definitive design incorporates a posterior cutout with a RevoFit-controlled posterior strap. Attaching a RevoFit dial to the posterior strap allows patients to make small adjustments to the proximal fit of their socket for greater pelvic stability and easier donning and doffing. The longer the posterior cutout is, the greater the adjustable range will be. The combination of panels and the cutout creates a socket with a large range of adjustability and fit. Where do I put the dial? Okay, this is kind of a trick question because on the definitive, you will have 2 dials. 1 to control the panels, and 1 to adjust tension on the posterior cutout. Both of these dials will be placed distally near the mounting block, where the patient can easily reach them and where aesthetically they blend in with the other socket hardware. The dial that controls the panels will be placed on the lateral side to give the largest panel the greatest amount of force when making an adjustment. The dial that controls the posterior cutout will be on the medial side. Make sure that the placement of these dials does not interfere with sitting. Also, notice that the further you insert the dial into the recessed area of the mounting block, the profile of the dial will be lower. Let's pause here so we can introduce you to the new RevoFit 2 dial base. If you remember, on the BK 3-panel design you built in the BK series, you used the dial base with the exit ports that were positioned 180 degrees from each other. We call this inline lacing. Well, the RevoFit 2 dial base has a handy additional lace port that also allows for you to route the lace paths parallel to each other. We call this remote mounting, which allows for you to place the dial almost anywhere on the socket. You just point the two remote ports in any direction you need to create the optimal lacing pathway. It's pretty slick. Now, how do I make it all connect? Keep in mind the rules for efficient lacing every time you design your lacing pathway. 1. Pathways must be parallel on the panels. 2. Pathways must be perpendicular to the panel's edges. 3. Pathways must extend 1 centimeter beyond the panel's edges before turning. 4. All turns or curves must have a gentle arc to prevent kinks. Next, sketch the pathway that will connect the posterior cutout. On the lateral side, draw a small turnaround and route the pathway across the cutout to the medial side. It's important to note that the laces crossing the cutout must be perpendicular to the edges, not angled as is typical with most posterior straps. Then descend the pathway to the dial base on the medial side. Next, sketch the pathway that connects the panels. First, use the quarter rule to establish where the lacing will cross the panels. Extend the pathway 1 centimeter beyond the panel edges. From the lateral panel, route the lacing pathway to the dial base on the lateral side. Notice that the dial sits slightly under the panel and the exit ports will point on an angle. Remember, for tight turns, use a round object to mark the pathway. This will help avoid making turns that might kink the tubing. From there, the pathways will cross the frame to the medial panel, making a gentle turn on the frame so that the pathways can connect smoothly to the quarter-line markings on the panel. Finally, use a round object to sketch the turnaround that will close the lacing route. That's it! The AK 2-panel design that rocks. It's one of the most versatile designs for AKs we've developed, and should work beautifully for most of your AK patients. We love it for its ability to stabilize the limb and the pelvis, and its broad range of adjustability. That means better fit and better comfort, so that your patients can spend more time conquering their day and less time in your office.